Hi, everyone, and thank you for joining us today for our Health and Human Services 101 briefing. We hope that the word has gotten out to you and your colleagues in the legislature, and we're really excited for you all to join us today. I wanted to quickly introduce our organization, and I'm just now seeing in the chat that my colleagues might not be able to turn their cameras on, so I'm going to try to figure that out for a minute. But I wanted again to welcome you today and thank you so much for joining us. My name is Tara Britton. I'm the Director of Public Policy and Advocacy with the Center for Community Solutions. Here are photos of the team. I'll figure out in a minute why folks' video is not being allowed to be turned on, but you can see them all here. And these are the folks who will be presenting today through our Health and Human Services briefing. We wanted to give this opportunity to policymakers and staff in the legislature because we know that health and human services programs are really complicated and you have to learn a lot quickly. So we wanted to offer this opportunity today. We are recording this presentation so that you are able to share this after the fact. We'll send the link around. But just really give an opportunity to give a 101. We're not getting super in the weeds, but definitely we'll have information that will be helpful to all of you in the legislature in making important policy decisions. The Center for Community Solutions is a nonpartisan think tank focused on health, social, and economic issues. We spend a lot of time looking at the research, looking at the data to make really to provide information for you all to make informed policy decisions. Our mission is to improve health, social, and economic conditions through nonpartisan research, policy analysis, communications, and advocacy. I wanted to just very briefly touch on our state budget priorities for this budget. These have been shared with all of you in the legislature and all of the staff. Thank you for all of your questions and inquiries. We're really happy to talk more about all of these issues as we go through this budget process. So I'm going to move into the next slide so that we can get moving with our presentation. Thank you.
Hello, everyone. I think I'll try to do this by voice only, Tara, if that's okay. So we can go ahead and move to the next slide. My name is Lauren Antis. I'm the Troyhoff Chair for Health Planning here at the Center for Community Solutions, as well as a public policy fellow who is a part of the public policy team, and my concentration is in the Medicaid program. Obviously, that's something that is of mine these days with the state budget moving forward. If you have any questions about this presentation, about what I'm about to present, or what my colleague Natasha Techimaika is about to present here in a moment, please do not hesitate to reach out. We are a resource, and we're more than happy to touch base with you on any topic as it comes up. Next slide, please. Okay, so one thing that we hear often, and I in fact heard this last week during the House Finance Committee, was that Medicaid is the Pac-Man of the state budget. What I have here is the totality of the state budget by funding area. And what you can see here is that Medicaid, which is the light blue on the bottom, has a relatively stable sort of share of the state budget in regards to how much it represents in terms of state GRF only. The red represents the federal participation, so the amount of money that we receive from the federal government in particular. What I'd like to note, if you looked at this, these numbers going back to 1975, when the Legislative Service Commission actually started pulling together this sort of information, what we have seen more than anything is sort of a defunding of health and human service programs and sort of a refunding of those same programs through Medicaid, particularly by leveraging federal dollars. So, while, it's certainly true that Medicaid makes up a significant portion of the state budget, it's important to understand how much that actually means in terms of state dollars. Next slide, please. All right, so what's important to understand here is the federal medical assistance percentage, and I'll sort of highlight this here in a second. But if we just look at what the state share has been over recent years between 1995 and the most recent fiscal year with state fiscal year 21, we can see that the state Medicaid average has basically been around 14%. So only around 14-15% of every dollar we spend actually comes from state general revenue resources. The rest either comes from provider taxes, which I'll describe, or from the federal government. Importantly, and this is something that should be of mind here lately in regards to the current state budget, federal dollars play a really significant role in budgeting how the state budget is funded overall. In some analysis I conducted last year, regarding the role of FMAP during times of economic recession, we often see the federal government play a pronounced role where the federal medical assistance percentage is increased. And what's interesting there is when that happens, we often see that the state obligation for funding the program goes down. So when there are times of economic recession, even though caseloads increase, we can see that the dollars that are actually committed by the state directly often go lower. So if you look at that chart, you can see in 2009 and 2010, those are some of the leanest years, so to speak, for the state Medicaid program. So when there is a recessionary period, the state tends to spend less, and when the economy is very, very good, the state tends to spend less, if only because there are less people on the program. Next slide, please. All right, so what does this actually look like? So if we took $1 of Medicaid, out of the 30 billion roughly that we spend through the state budget on Medicaid, only 15% comes from the state GRF, according to this latest budget proposal from the executive. 14 cents out of that dollar come from provider fees on organizations like nursing facilities, hospitals, and health insurance corporations, and 71 cents out of every dollar come from federal sources. So that means for every dollar that we spend in state-only general revenue, we get $6.50 back in terms of services. Now, what you might hear from some folks is that, these federal sources are also Ohio sources, right? These are still taxpayer sources of revenue. But what's important to understand here is that Ohio is a recipient state when it comes to federal taxes. So what does that mean? Because we tend to do pretty poor economically compared to many other states, for every dollar that we send to the federal government in taxes, Ohio receives $1.42. So, by and large, Medicaid represents a pretty sound investment by the state. 1 in 4 Ohioans are covered through the program. And really, it's this understanding of how the Medicaid program is financed, which gives you the best sense of essentially what its programmatic intents are, how to leverage different policy points, and what it may mean for the overall budget picture. Because every time, Medicaid comes in terms of underspending, it may allow for spending to take place in other places like education, corrections, etc. Next slide. Okay, so if we just look at what this means in the sort of current landscape for Ohio, this is the impact that Medicaid has had relative to COVID-19. So on the left-hand side, you can see the Medicaid state share between February of 2020 and December 2020. And on the right-hand side, you can see the federal share. What I really want to call out here is the role that this increase in federal assistance has played, particularly for vulnerable populations who may be adversely affected or disproportionately affected by COVID-19. Despite the fact that we've had 328,000 more enrollees between these two time periods, the state is actually spending less money directly. So when it comes to what we're talking about, if you look at the category of ABD, or age, blind, and disabled, this includes older adults, this includes individuals with intellectual disabilities, so on and so forth. We're actually spending about $58 million worth of difference between those two populations between February and December. That's not a cumulative total, that's just a month-to-month comparison. And why this matters, I think people often think that some of where FMAP plays a role is primarily through the Medicaid expansion. The reality is the Families First Coronavirus Response Act and the Public Health Emergency did not add additional federal supports to Medicaid expansion, but to all other populations. So what this looks like is about $106 million difference per month that the federal support represents for the state of Ohio to accommodate that increased caseload. This is also why in the context of the state budget, we've seen so much in terms of a shift from year to year, state fiscal year to state fiscal year, what the governor or the governor's staff director Corcoran is describing as the pig and the python, and the cliff is this need to transition people out of the program once the public health emergency is over, and thus the federal supports are no longer available. So this gives you a sense. There's more information we have on our website about this, and of course, I'm happy to answer any questions. But at this point, I think I'd like to turn it over to my colleague Natasha to talk more about the role of long-term care in the program.
Good afternoon. My name is Natasha Techimika. So I am also one of the Public Policy and External Affairs Associates. And I focus on mainly organizations in Northeast Ohio. And I focus on public health policies and research. But if you have any questions for me doing this presentation about nursing facilities, feel free to reach me at my email address. Next slide, please. So the role of nursing facilities in Medicaid is pretty much almost straightforward. Nursing homes are licensed by the Department of Health. So once they get licensed, they can perform different health services like long-term care services, rehabilitation services, and have nurses on site as well. It is important to notice that Medicaid pays for services in nursing facilities. So before they even have Medicaid to pay for the services, the facilities must meet federal and state requirements first. And it's a mandatory benefit. However, there's a shift towards home and community-based services. So now you will see a lot of older adults going from the nursing homes or preferring not to live in nursing homes because they prefer to live in homes for a longer period of time. So only Medicaid provider type with rates are set in statute. So there is a standard Medicaid payment rate, as you can see in the box. And that equals to direct care costs plus ancillary and support costs. And then you also have to include the capital costs, tax costs, the quality add-on. However, you must subtract the quality deduction and add the quality payment and critical access assessment payment. The quality payment and the critical access assessment payments are special payments by nursing facilities. Next slide, please. And right now, as you saw in the budget, there is a nursing home reform initiative, also known as the Bed Buyback Program. So this is a collaboration between the Ohio Department of Health, the Ohio Department of Aging, and the Department of Medicaid. And they are planning to invest $50 million to buy back nursing home beds and nursing facilities. This program is voluntary for nursing homes. And it's important to notice that Medicaid is responsible to pay a portion of costs for unused beds. So before COVID-19 happened, there were 11,000 unused beds in nursing homes. So through this program, they are trying to save money by buying back the beds. In fact, Medicaid is planning to purchase beds for $10,000 a piece. Other states have implemented this program. In fact, in Oregon, House Bill 22216 has passed. Their program is only voluntary as well, but they collaborate with the Department of Health and Human Services. And they reimburse nursing facilities to reduce the number of beds. And they do this because they want to limit the increasing per capita cost of health care while improving patient care. And I did include the links so you can learn more about Oregon's buyback program. Next slide, please. So why is the nursing home reform initiative important? Well, first, it helps save money. Two, it supports community-based care options. So more older adults prefer living longer in their homes, and there are already services provided by the state that do this, such as the PACE program. And finally, it helps slow the spread of COVID-19 nursing facilities. And this will happen by transitioning double rooms to single rooms. And I did include a link about an article about that, where the chief policy officer from Ohio Medicaid talks about it briefly. Next slide, please. All right, so I will pass over to Will. He will talk about aging services in Ohio.
Great. Thanks so much, Natasha, and good afternoon, everyone. My name is Will Tarter, and I serve as an Associate of Public Policy and External Affairs at the Center for Community Solutions. I have a particular focus in older adults and some aspects of social determinants of health that affect their quality of life, including access to public transportation. I hold a Bachelor's of Science from Ohio University and also a Master's in Public Administration. I'm thrilled to be able to speak to you today about older adults and why they're a critical component to our state, and offer some information on why they're going to be a critical component of our state's present and future. Next slide, please. So in this brief overview, we're going to talk about demographics, because they are the big driver of a lot of aging conversations. Then we're also going to discuss the impact that the demographics and the changes will have on public policy. We'll discuss some of the state agencies that are present at the state level that will assist in our transition in this aging economy. And then I'll briefly mention some nonprofit agencies at the state level that are also involved in policy and advocacy. All right, next slide, please. All right, so in Ohio, right now, there are approximately 2.8 million adults over the age of 60, and this represents 24% of our population. By 2030, less than 10 years, there'll be over 3 million adults over the age of 60, representing 26.3% of the overall population. Next slide, please. When we compare the aging demographics of the state of Ohio to the entire country, we'll see that we're not just an aging state, we're an aging country. Baby boomers are the second largest generation in the United States, numbering over 77 million people. Currently, baby boomers have approximately 57% of the nation's wealth, compared to Generation X, which is 16%, and millennials, only 3%, according to Federal Reserve data. This has a massive impact on economic and community development. We're talking about older adults representing approximately 0.25% of the population, but having a high percentage of the nation's wealth. This means that they have a huge influence on economic and community development, present and future. Next slide, please. So it's important to also understand that while we talk about the critical amount of wealth that are in baby boomers, there also are opportunities for the public agencies to step in and assist, because people may not necessarily have the resources needed to maintain a high quality of life. When we look at the Federal Reserve Bank data, in 2020, 1 out of every 4 Americans had no retirement savings, and fewer than 4 out of 10 Americans feel their retirement savings are on track. According to a recent study, bankruptcies for older adults are 3 times higher now than they were in 1991. And 27% of adults age 60 and older currently live alone. And approximately half live with a spouse or partner with no children at home. What this means is that, again, you're not going to have necessarily the same accessibility to services for older adults. as well as both in numbers of individuals and income in the home. So there definitely is going to be a need for a strong support network. Next slide, please. When we look at the city of Cleveland, we just published a report a couple of weeks ago that examined the poverty rate among older adults. And just to put this in perspective, in the city of Cleveland, for individuals over the age of 65, poverty was 22.7%. And that's an increase from 22% in 2018. The city of Cleveland now has the second worst poverty rate for individuals over the age of 65, trailing only Miami, Florida. Go to the next slide, please. So this is not a urban issue, suburban issue. This is going to affect everyone in every part of the state of Ohio. We talk about the demographic shift that's taking place. This is going to happen across the state of Ohio. When you look at many of the counties, this is by 2030. Many of these counties will have at least 25, sometimes 28, 29% of their population age 60 and over. That's in the mid shade of green. In the darker green, those are counties with over 30% of their population. I want to particularly call attention to areas such as Ottawa, which has 35.3% of their population, and Hocking, 31.3% of the population, and Brown, 33.9%. So we talk about almost 1/3 of these counties that will have populations of at least 60 and over. Next slide, please. When we examine the intersection that these demographic changes are going to have across our state, I mentioned public transportation earlier. As older adults drive less, they will take public transportation more. This also means accessibility to foods and markets. It also has an impact on mental health. When we talk about older adults, many of whom are living alone at home, it will be so important for them to get outside of the house, to interact with others. And whether that means taking a walk or taking transportation to get to healthcare appointments, there's going to be a need to prevent social isolation. Senior centers and social programming are going to play a critical part of the quality of life for older adults, making sure they can congregate together. There are programs available to support them. They're also connected to programs that are available to help for things like utilities and housing. It's also going to be really important for them to have internet access and connectivity. We talked about Medicaid and how that is the principal funder for long-term care, and many other issues where the older adults in the state of Ohio are going to have a huge impact on our public policy decision-making. And it's best to have those types of conversations now rather than trying to wait when the age wave will already be here. Next slide, please. The good news is that there are a lot of agencies in the state of Ohio that have resources available to support older adults. The Ohio Department of Aging is the principal department that is responsible for older adults. Many of the programs that are available to support seniors and their caregivers are administered through ODA. The Ohio Department of Job and Family Services also plays a critical component to the well-being of older adults, as Adult Protective Services is funded out of a line item in the ODGFS budget. Many county agencies are also affiliated through Job and Family Services. So in some counties, they'll have joint children and seniors. Some have dedicated organizations that serve seniors, but they fall under the JFS umbrella. The Ohio Department of Mental Health and Addiction Services also has resources available to support older adults and their caregivers. And the Attorney General has the Elder Abuse Commission, which is devoted towards trying to prevent the exploitation of seniors, of physical exploitation, financial exploitation, and others. There are other organizations that are nonprofits that support seniors in both public policy and advocacy, and I'll be happy to provide additional information if anyone needs it on what organizations are out there that can get you more information. With that, That concludes the aging section of our program, and I will give it to my colleague, Hope, to discuss SNAP.
Thanks, Will. My name is Hope Lane. I'm an associate for public policy and external affairs here at the Center for Community Solutions. I primarily work on issues of public benefits, including the SNAP program, as well as maternal and infant health, as well as racism as a public health crisis. I'm a graduate of both Kent State University and the George Washington University. Next slide, please. Okay, so what is SNAP? SNAP is the acronym for the Supplemental Nutrition Assistance Program. Other common names or previous names for the program that you may hear are food stamps, EBT, which stands for the Electronic Benefit Transfer, nutrition assistance, or simply just food assistance. Next slide, please. Okay, so what is SNAP? SNAP is the largest federal nutrition assistance program. The benefits themselves are completely federally funded, but state administered. So this means that states often share in the cost of administering the program, like paying staff, and that states have autonomy over some of the eligibility requirements, such as asset tests. So this means that if you qualify for SNAP in Ohio, that doesn't necessarily mean you would qualify for SNAP in Indiana, for example. SNAP provides benefits to eligible low-income individuals and families via an EBT card. This card works as is very similar to a debit card and is used to purchase eligible food and authorize retail food stores and farmers markets. Next slide, please. So how does Ohio work? So I just talked a little bit about how the SNAP program is federally funded, but it's state administered, meaning states have autonomy over, a lot of autonomy over the program. So qualifying in Ohio doesn't necessarily mean you qualify in Indiana. So in addition to that, Ohio is one of 10 county administered states. So this means that applicants apply to their county job and family service agency for benefits, not the state agency. So although we do have a state agency, which is the Ohio Department of Job and Family Services, the State Department of, again, the Ohio Department of Jobs and Family Services does not process or deal with specific applications. So all 88 counties have a Department of Job and Family Services. So that's where one would apply for benefits and get approved, and the caseworkers that they interact with are on the county level and are county employees as opposed to the state. In county administered states, counties often contribute significant levels of local funds to meet the administrative and supplemental costs of running the program. So often the county, again, the employees that work at the county departments of Job and Family Services are paid for, at least in part, by the counties themselves and local government funds. Next slide, please. So how does Ohio work? So Ohioans are able to apply online via printable application or via phone. So once you apply, an interview is scheduled in person in office during normal times, if you will, via phone or via home visit, which is a rare occasion, but it does happen for certain populations. So an interview is scheduled with a county caseworker to review your application, advise the applicant of their rights and responsibilities, and resolve unclear information from their application. If approved, benefit amounts are determined based on household size, expenses, and in some situations, resources. Participants would then receive their EBT card via USPS mail. So cards are not given same day. They're not printed in county offices, but they are instead mailed to eligible recipients. Next slide, please. So qualifying generally depends on whether or not your household's gross monthly income is at or under 130% of the federal poverty guideline, which changes every year. Gross monthly income, just as a friendly reminder, is the household income before any deductions are applied. And then your net income, which is after deductions, must be at or below the poverty line. For a family of three, the poverty line used to calculate SNAP benefits in federal fiscal year 2021 is $2,353 a month. Assets, including a car and a bank account, must fall below certain limits, which in Ohio is $2,250. So there are exceptions to these rules. For example, for a household with a member who is elderly or disabled, the asset limit is a little bit higher. Next slide, please. A 1996 federal law limited individuals who are over age 18 and under age 50 to 3 months of SNAP benefits every 3 years, unless they are working or in a work or training program 20 hours a week. There are exceptions to this requirement, including pregnant women, households with children, those determined to be physically or mentally unfit for work, etc. Next slide. So as of December 2020, over 1.5 million Ohioans were receiving SNAP receiving SNAP in 750,000 households. SNAP is a crucial work support. SNAP helps local economies, especially during times of hardship, by increasing both food and non-food purchases. And things like PEBT, which was the pandemic EBT program, which was approved through Congress last spring, which allowed for families with children who were no longer receiving their meals at school to receive a pandemic EBT card via mail to be able to feed those children, along with emergency allotments. And the maximum benefit amounts have prevented many Ohioans from being food insecure throughout the pandemic. Next slide, please. I'm going to pass this over to my colleague, Tara Britton.
Thanks, Hope. Sorry again about the video issues. I think I am not used to setting up Zoom webinars, but I'm glad we have so many photos in here so you know what we look like. I'm the Director of Public Policy and focus on a range of health and human service issues, including safety net services and working on issues of maternal and infant health along with others on our team. And you're able to reach me there at the email address listed. I know that we will be sure to share these slides with everyone who's attended. We're also recording this again, so happy to share that link and make that shareable for all of you. I'm going to talk a little bit about TANF, or Temporary Assistance for Needy Families. Other common or previously used names include welfare or cash assistance. So some big changes happened with this program in the 1990s. Changed from an entitlement program, meaning that everyone who was eligible would receive benefits, into a block grant, which is a set amount of money that the state receives from the federal government. And the state has to match those dollars with a maintenance of effort to be eligible for the federal funds. So this happened in the mid-1990s. You may have heard this referred to as welfare reform. And this made big changes to this program that really transitioned it away from being an entitlement to a block grant. You know, some different things to consider as it relates to a block grant. There is the ability for states to do some things with different flexible creative programs, which I'll talk a little bit about, but it also means that, you know, it's a set amount of money, and so it cannot be as responsive to changes in the economy. TANF provides cash assistance and other supports to low-income families with children. That's the key there. Children have to be a part of the family unit to receive TANF. Adult members of the families are required to work at least 30 hours per week to receive benefits. And then talking a little bit about the funding, because this program is a block grant, Ohio receives about $728 million per year from the federal government. This has not changed since the 1990s. This amount was determined based on what was being spent on poverty reduction programs in the mid-1990s. So you can imagine, you know, this is not adjusted for inflation. Those dollars don't go as far as they did back in the 90s. The amount that the state puts in through its maintenance of effort is $417 million, roughly. So a little over $1 billion through federal and state funds is dedicated to this program every year. These are just a few of the major TANF funded services in Ohio. So as I mentioned, you know, it's a block grant now since the mid-1990s, and the state has a little bit more flexibility in what it can use the dollars for. But the main components are cash assistance program, which is kind of those eligibility requirements that I just talked about and we'll touch on a little bit more. The state also uses a large portion of its TANF budget to pay for childcare. The Prevention, Retention, and Contingency Program, that's a really wonky term. And if you hear the term PRC, that's what that's referring to. But the idea behind that name is to really prevent folks from getting onto cash assistance. So this is something that the counties are able to make some determinations about what the needs might be for people in their community. This can help. It truly is sort of, emergency type of funds. If someone needs a car repair done to avoid kind of a slippery slope into a worse situation, these funds can help with things like that. And then fairly recently, a product of the CASIC administration, the state has embarked on the Comprehensive Case Management and Employment Program, which is focused on kind of young adults in the TANF program to help really focus in on some wraparound case management to help folks stay in school, find employment. And that program has been in place now for the last several budget cycles. So just to kind of give a sense compared to what Hope talked about for SNAP, to qualify for TANF in Ohio, adults who have children can get cash assistance, work, training, and other support services to assist towards self-sufficiency. I talked a little bit about the Prevention, Retention, and Contingency Program. This does not fall into that cash assistance program. So, there are still income eligibility requirements and things, but it's a little bit more flexible than the formal cash assistance program. Adults with children whose income is at or below 50% of the poverty level. So it's really low income. The income is set very low to achieve eligibility or maintain eligibility for this program. And the state of Ohio has a 36-month limit for cash assistance. The federal law allows 5 years, but Ohio has set it at 3. And then most adult recipients must work a 30-hour work week to meet their work requirement. And then overall, the state, with its total number of adults on the program, has to meet a work participation rate of 50% or else face penalties from the federal government. So this is very relevant to the budget, and I know these are a little bit tough to see, but I just wanted to pull out a snapshot of what this looked like from the last budget. This is the state's TANF services framework. For those of you who have been involved with multiple budgets, this used to be what we call the TANF plan. We, anxiously await this document for every budget so that we can see current and forecasted spending in the TANF program, again, typically released along with the state budget. And this is the most detailed account of spending within the program that we get, on a pretty routine basis. This also is where it helps us to identify any underspending in the program, which is truthfully a chronic issue with the TANF program. We see underspending in many categories because of, we forecast a potential caseload or think a program is going to roll out one way and it doesn't. And so that can contribute to underspending. I'm going to turn it over to my colleague, Emily Campbell, who's going to talk about the benefit cliff, which kind of puts a lot of the things that we've talked about today into a broader perspective.
That's right, Tara. Thank you. Good afternoon, everyone. My name is Emily Campbell. I'm the Associate Director and Director of Research at the Center for Community Solutions, and I'm happy to be joining my colleagues on the policy team to share some additional information about the resources that we are about to put out that will be available to all of you, as well as the issue of the benefit cliff. So if we can go to the next slide. Thank you. Couldn't remember where we went next. Let's start first about talking about some of the things that you might be able to find from the Center for Community Solutions that we hope will be resources and can be helpful for you all as you work on state level policy that can improve things for Ohioans. Next Monday, March 8th, we will be releasing updated fact sheets, one for each House and Senate district, as well as all of the congressional districts for the state of Ohio. We are very excited about being able to compile this data all together because it will have data and information and statistics by legislative district on topics including population, income, employment, and poverty, food bank benefits eligibility, education, health, internet access, housing, and some additional information about public benefits. So please keep an eye out for that. They will be posted on our website, which is www.communitysolutions.com. And again, we are expecting to release them next week, and we'll be sharing them with each office over the course of the next couple of weeks. If we can go to the next slide, another piece of our research that I think is particularly relevant to today's conversation is work that we've done around the benefit cliff. So the benefit cliff is something that we hear about increasingly as we think about trying to help Ohioans move out of poverty, off of benefits, and toward economic independence or self-sufficiency. So we often think of the path from poverty to prosperity as an escalator. You just kind of get on a career pathway and it's a smooth ride. In reality, people's lives are complicated and it's not that simple. And part of the reason is the benefit cliff and the way that public benefits are designed. Our first publication on this topic, we called it a roller coaster because, as you'll see in a minute, in Ohio as well as in other states, there's not just one benefit cliff, there's a series of cliffs that people encounter. So here is one of the most simple definitions that we've been able to find. It's adapted from the Colorado Women's Fund. As low-income families qualify for work support benefits that help cover the cost of basic necessities. These are things that we have already talked about today. Medicaid, TANF, SNAP, childcare is also a big one that we take a look at, as well as housing programs that are federal programs through the U.S. Department of Housing and Urban Development. But as earnings increase, families begin to lose these benefits because there are income eligibility requirements. And the result is that people can earn more without improving their family's financial situation. Most of the time, a raise is a cause for celebration, but for some Ohio families working at low wages, earning just $1 too much can mean the loss of a benefit that is really helping their families make ends meet and can be worth hundreds of dollars a month. We hear stories of employers and social service providers talking about low-income workers who turn down raises or decline promotions or refuse additional hours. And the employee explains that if they earn too much, they'll lose food stamps, they'll stop getting help to pay for childcare, or they'll have to move out of their subsidized housing. And the financial burden and disruption to their lives simply isn't worth the small pay increase. So this is something that Ohio has actually improved over the last couple of years with changes to the child care program and to benefits and eligibility, but there's more that can be done. And if we go to the next slide, you can see that the Center for Community Solutions has put together a model so that we can take a look at where cliffs might occur and what programs might be causing them. We look at a family of 3, which is made up of 1 parent and 2 children, a child who is school-aged and a child who is preschool-aged, which really matters for the amount that they have to pay for childcare. We look at a basic budget, which is very basic and below estimates of what a living wage would be. And we look at the amount that public benefits helps that family to make ends meet, specifically SNAP to help cover some of the cost of food, housing assistance through HUD, Medicaid for health coverage, and the state child care program. And if we go to the next slide, you can see what our model came up with for an Ohio family of 3 in 2020. You'll immediately notice that starting out working full-time for the minimum wage, which in 2020 was $8.70 an hour, this family does not make enough to be able to make ends meet, even with assistance from those public benefits that are helping cover some of their monthly costs. The child care copayment beginning causes a small dip, but they're able to recover pretty quickly. When they are over income for the SNAP program, it causes a plateau where they are earning another extra $1 an hour, but not getting any further ahead. When the parent loses Medicaid coverage at 138% of the federal poverty level, it causes a small dip, and so on. The biggest dip that we see in Ohio's benefit cliff is caused when the family is over income to qualify for the Children's Health Insurance Program, or CHIP, This is the basically Medicaid for children. And then the child care co-payments increase rather rapidly and causes them to plateau. So it's not until this family is earning more than $27 an hour that they have left all benefits behind, and every dollar they earn is a dollar that helps them get further ahead. We have lots of additional information about the benefit cliff available on our website. Thank you for posting it in the chat. But I think one thing to keep in mind is that working families in Ohio, many of them do continue to struggle. And in fact, in Ohio, there were about 100,000 adults that worked full-time for the full year in 2019 and still didn't earn enough to be above poverty thresholds. And so these work supports and public benefits are helping these families meet their basic needs and are often called work supports because things like childcare enable parents to continue to work even if they don't earn enough to be able to afford childcare on their own. So these benefit programs can change the calculations for some families about whether or not working or working more makes sense. So with that, I think I will end, and I believe, Tara, it's time to open it up for questions if I'm correct. Perfect. So I see a question here about the $15, oh, we can start video, great. The $15 minimum wage, and that is a great question, looking at the benefit cliff. So $15 an hour is right at the point in our cliff where families are starting to lose a number of benefits and be over income for a number of benefits. And so we have to look at kind of the full income and benefit package. You know, certainly for some families, they may be pushed over a cliff. But when we're thinking about moving out of poverty, anything that we can do to help families have more resources and more income will have positive impacts on Ohio's high poverty rates and certainly our high child poverty rates. So really something that we need to look at in a full picture of what it might do for a family.
Great, thank you. I know our team has been monitoring the chat throughout, so if there are other questions you all have seen that we should answer on camera, you know, we'll be sure to send the slides out. It took me a while to find the camera controls. They are buried in the panelist options, but I found them, so you can see everyone now. Any other questions, please feel free to submit them through the chat or Q&A. Again, we'll be sharing everything afterward. Please share the presentation link with anyone who wasn't able to make it today. I know we went through a lot in a short time, but we hope that it was helpful as you all are in the midst of this busy budget season. And I don't know if there are any other questions from folks. I don't see any.
Tara, if I may just add one quick note.
Absolutely.
During my presentation, I talked about the various counties across the state that are going to have different aging populations. We've also done some research on senior levies by county. So if you are interested in the amount of funds that are raised by senior levies by counties in your district, please let us know. We'll be happy to get that information to you as well. It's very uneven, and that's something we draw out in our articles. Thank you.
Thanks, Will. So I think we just will close today by saying thank you for your time. We really appreciate you taking time out of this busy season to hop onto this webinar. We hope it was really helpful. I think kind of the other main takeaway for today is we have a lot more information to share on all of the things that we talked about today. So please reach out to us if you have questions on anything that comes up in your work. We are more than happy to help and set up Zoom or team meetings, and hopefully one day soon meet in person again. Thank you so much, everyone, for joining us today, and we will hopefully connect with you soon.